Hi, my name is Tiffany, and today I'm going to be performing a newborn assessment on Teddy. When I go into the patient's room, I will provide hand hygiene, I will put gloves on, I will provide privacy, dignity, and I will use age-appropriate communication. I will also introduce myself to the parents as I either take the baby from mom or as I approach them. The next thing I will do is I will obtain a birth history. What kind of birth did mom have? Any traumas, that kind of thing. Then I would go straight into vital signs. I would check the baby's temperature, and I would use a thermometer on the baby setting axillary. The temperature should be between 97.7 to 99.5 degrees. You don't want to do rectally because it can be more damaging than good. So as a nursing student, we should never perform that rectally. Next, we will listen with our stethoscopes to obtain the pulse. You would listen for 1 full minute. It should be anywhere between 120 to 160 beats per minute. Next, you would want to either feel for respirations or you can listen to the baby's breathing. And it should be anywhere between 30 and 60. As you're listening to the baby's breathing and pulse, you could also assess the baby's lungs, make sure that they sound good. Even if they sound like they have some crackles or a little bit of fluid in there, it's okay because it's normal for babies to have a little bit of fluid left from the birth. And C-section babies will also have more fluid than a vaginal baby. Next, you could also listen for any heart murmurs. And if there is a murmur, you would want to document it. And each time you do an assessment on mom, I would even just check baby's heart and just see how he's doing and just document it. It is normal for babies to have a murmur. They usually close as they age. The next thing that you would want to assess is your height, well, your length, your weight, and your head and chest circumference. So the length should be 48 to 53 centimeters. Your weight should be 5 pounds and 8 ounces to 8.13 ounces. Yes, and then your head circumference, you will just take a little tape measure and you'll just measure around the baby's head. The head should be bigger than the chest. The head would be the head circumference should be 32 to 38 centimeters. Then the baby's chest, which you would just take a tape measure around the baby's chest, around the nipples, and you would measure, and it should be 30 to 36 centimeters. I think that's it for that. Good. Do they have good muscle tone? Are they symmetric? How are they crying? If they aren't crying, eventually throughout the assessment, they will cry. At some point, they will cry. How are they acting? Are they quiet and active? Are they crying and active? Are they inconsolable? You want to look at the baby's skin, like tone. You want to see, it should be pink, could be a little tan, a little acrocyanosis could be present. You don't want to see any bluing of the lips, that could be bad, but if you do see bluing of the hands and feet, that can be normal because the blood is going to other areas of the body. While you're looking at the baby's skin, you want to see if there's any vernix left over. Sometimes it can be inside the ear, it can be in the neck folds, it can be under the arms, it can be in any crease, any fold from the fat. You want to look at muscle tone. You want to see how the baby is he doing okay? Is he holding how he's supposed to? Is he what is his body looking like? The next thing that you want to look at is for any mela, which is the little white, they kind of look like little pimples almost on the baby's face. But you don't want to pop them. There's just little leftover calcium deposits. The next thing that you would want to look at is for, I'm going to butcher this word, but languule, I don't know. But it's the soft skin, like the hair on the baby's skin. The next thing that you could look for is erythemia toxic something. I'm going to butcher it. You will look for erythema. The next thing that you want to look at is magnolia spots. They can be like a little bruising on the bottom of the baby's buttocks. They just look like little bruises. And the next thing that you would look for could be the petechiae, which is the little pink, not little pink, but the little red dots that can be on the baby. That we would go over is the baby's head. And if you ever set the baby up, you want to make sure that you're holding onto the baby's neck properly. But when you're assessing the head, you want to assess for the frontal and posterior fontanelles. You want to make sure that you can feel the sutures in between. You should be able to feel them in the frontal and in the occipital region. You want to see if there's any molding, if there's any cephalahematomas present, which could be like a almost like a knot, but it's like a pocket full of blood that is between the bones and the skin. The next thing that you would want to look at is if the face is symmetric. You want to make sure that the eyes are symmetric, the nose is okay. When you are looking at the face, you just want to see if the appearance is okay. Is it normal? Is there anything that is noticeably abnormal? The next thing that you would move into is the eyes. What is the iris color? You would want to see they're symmetrical, they're clear. Hopefully the mom got the azithromycin, which is an antibacterial for the baby's eye. Another thing that you would want to look for is if there's any conjunctivitis. Is there any tears present? See if the pupils are equal, round, and light reactive. It's always good to check the baby's eyes. The next thing that you would want to move into is the ears. You would want to see and make sure that they are symmetrical with the head. Make sure that they aren't like too low, too high. You would check inside. You might see some vernix in there. You just want to make sure that they're well formed and that their alignment is proper. For their nose, you would just want to make sure that patent bilaterally. The next thing that we'd move into is the mouth. Now, with a gloved hand, I would stick my finger inside the baby's mouth, and I would make sure that the baby has a strong suckling. I would make sure that the palate is intact. You don't want to see any cleft lip. You want to make sure that the baby can really latch on to your finger and has a good strong suck for if it's breastfeeding or for feeding in general. You would even open up the baby's mouth. You would see if you could see any Epstein pearls, which is like these little blisters that usually go away. You would also want to see if you can see any percutaneous teeth, which are teeth that are not rooted, but they can be pulled. You would also want to assess the swallowing. And that could be done if you place something in the back, like on the baby's back of the throat. Next thing that we would move into is the neck. You could turn his head easily. For the chest, you would want to make sure that the appearance is the xiphoid may be prominent. You want to make sure that they're symmetric. You would even look at the nipples. There may be they may be a little engorged. Like a white discharge, and that can be normal. That's just from the mother's hormones leaving the baby. We already talked about assessing for breath sounds. You want to assess apical rate and any murmurs. The next thing that you want to assess for is the abdomen. You would inspect. And so the baby should have an intact umbilical cord that is clamped. That will not fall off yet until it dries out. You should see that there's 2 arteries and 1 vein. On the umbilical cord, you should see that there's 3 little vessels before, so you have the clamp, and then it should be right on the end that you can see. And you just want to make sure that before you touch the baby's stomach, you want to auscultate. You want to make sure that the bowel sounds are present, and they should be present soon after birth. The elimination patterns, you would want to ask the mom or the parents how many wet diapers has the baby had recently. They should void within 12 to 24 hours after birth, and they should have their first bowel movement of meconium between 12 to 48 hours. The next thing that we'd move into is genitals. Now, if it's a female, we would see if there's any discharge. If it's like a white mucus discharge, that is normal. We would make sure that the labia is covering the clitoris. If it was a male, we would want to make sure that the meatus is at the tip of the penis, and then the testes, we want to make sure that they have descended and that they have good rugae on the testes, like on the scrotum. Excuse me, not the testes. You would want to make sure that the testes have dropped and that they are in the scrotal sac. You want to make sure that there's rugae on the scrotum. The next thing that we would go into is extremities. Now, when I first started, I already looked at the baby from the outside in, but you want to see if there's equal bilateral movement. Can the baby, like, how is the baby responding when you move? When you do its hips, is there any clicking, any clonking? How is the range of motion? You want to check to make sure that there's 5 fingers on each hand and each foot. You could also check to make sure that there's the proper wrinkles on the feet. You want to make sure that there's no hip dislocation, and make sure that the feet are in a normal position. You can hold them up and you can check and see. The back and spine, the vertebral column alignment, well, we would hold the baby like this, but we would make sure that there's no openings, that the vertebral column is aligned and there's no openings. You would even turn the baby over, and you would want to make sure that the anus is patent, and you want to make sure that the sphincter is closed. Now, lastly, we would go into reflexes. So you have your Moro, which is if you drop the baby's head 30 degrees, the baby should kind of like have a startled kind of appearance. We did this in clinical, and she didn't really pick the baby up like off any far, but she just kind of did a slight movement, and the baby jerks and jumps. Tonic neck would be the baby turning its head when it's in a supine position. The palmar would be grasping. Your baby would grasp your fingers. The Babinski reflex would be just rubbing your finger up against the baby's foot, and their toes should spread. The next thing would be plantar, and you would be able to tell that way as well if they fold in, if you just hold into them. Another reflex that you could check is, well, we've already checked it when we did the mouth assessment, but you would want to make sure that the baby can suck perfectly fine. So it would be the sucking reflex. Another reflex to check is the rooting, and that's when you just kind of gently rub the baby's cheek, and they should turn towards whichever way your finger is. We've already checked the swallowing when we did the mouth. Another thing that you could check is for stepping, and you would just hold the baby up, and the baby should take some steps for you as you're holding. Another thing that we would check for is the trunk incurvation, and you would just run your finger along the vertical column. And that would be it for reflexes. Now for behavioral state, I would say that this baby is quiet and alert. There's active alert, there's deep sleep, there's light sleep, there is like heavy crying, like intense crying. But after that, all of that should be okay. But you would want to state what behavior the baby is showing during the assessment. And when I'm finished, I would swaddle him back up, and I would hand him back to mom preferably skin to skin so that they can bond and he could be warm.